Hi guys, and welcome back to our channel here at Libra Aesthetics and Wellness. I hope everyone is doing well. For today's video, we will be discussing our healthy hair program. So if you want to hear more, keep on watching. So guys, of course our hair, our crown is very important to us. And so here we have a program here at Libra for persons who have issues with hair loss. So in a healthy hair program, we typically do a 16-week cycle with you, where in the first visit, we'll consult with you. We'll try to diagnose the reason why you have the hair loss. We'll do, certain questionnaires. We'll determine by the Lubbock or the Norwood scale what is the stage of hair loss you're in, whether you're a male or a female. We'll get your pictures done of your scalp. We'll do your hair pull test. We'll order your labs, especially if we think there are autoimmune etiologies or nutritional factors contributing, and we'll discuss the program. You'll come back in the second week. We'll do a lab review. We'll give you an IV infusion, most times as indicated, because we really want to give you the nutrition to help the follicles recover. We'll go ahead and get your supplements that you will need for that during that time. And you may need medications depending on what the issue is, whether it's ketoconazole or finasteride, spironolactone, certain things like even cimetidine in women, and Nizoral for androgenic alopecia. So we'll decide what you need for treatment. And then we'll order a special topical treatment, shampoos, and a foam that you use in your scalp. And then when you come in for your next visit, we'll go ahead and give you the PRP. So you'll see in the next clip a consultation on PRP and the procedure for that, where we give platelet-rich plasma into the scalp, which is a treatment that stimulates the stem cells in your own body to recover and to grow back, especially if you still have the fine villous hair. That's like, how we call the little baby hairs. If you still have those, then we can try to stimulate those to make a full follicle again. You'll come back for your further visits. We'll keep in the next visits weekly as you come in. We'll be giving you some laser therapy for your scalp to help regenerate the follicles. It's a red wavelength, which this spectrum of light is known to stimulate stem cells as well. We'll give you B-complex, biotin, and certain other injectable medications. As you keep coming through, we'll check your scalp for scalp health, and then we'll decide if you need more PRP further on in the treatment. By week 12, we can assess that. You'll come back, and of course we'll do your lab review at the end and determine that you have improved from baseline. Now, of course, the full hair growth won't be seen in 4 months. In 6 months, you can also come in again and reassess. But in this program, at least we can put you on the right track to getting your hair needs taken care of. Because as you know, hair is not just, dead keratin, but it actually reflects your inner health. If your hair is breaking off and terribly not shiny and dull, it tells a lot on your inner being. So that's why here at Libra, we have a program for that. So we'd be happy for you to consult with us in that regard. So look for the next clip where we'll show a consultation and the procedure of PRP to the scalp. We hope to see you soon.
Hi, Dr. Thomas. So today, I'm looking at some issues with, my hair as men get a little bit older, right? They may lose some hair, there may be some thinning, and I'm told that looks like I have the LeBron effect going on here. So what can you do for me today?
Oh, hello there, Dr. Nichols. Nice to see you. Well, that's something that a lot of us have issues with as we get older, which is hair loss. But this can also be, when we're younger, as there are many factors that can contribute to the hair loss. The genetic factors, and in women, it could be from like just pulling your ponytail too tight. So, the technical term of alopecia, as we call it, can be treated in a variety of ways. So what I think would benefit you today is if we do a treatment called platelet-rich plasma, which is, we call it PRP for short. And as you know, it is where we spin your blood down and we kind of purify and concentrate the plasma, which has the platelets in it. And those platelets, when we sort of break them down, they have a lot of factors in it, like growth factors that can stimulate growth in, you know, different parts of the body and help, like stem cells, which are very, you know, quiet and not very active. It'll help them to wake up.
Huh. So what's the advantage of this over just hair grafting?
Okay, well, I guess the cost hair grafting is super expensive. If that's something someone can afford, sure, it's probably the gold standard, I'd say. But PRP and hair grafting would be better if you have absolutely no hair there. Okay. You know, if you just have skin left. But if someone who has hair, if you still have these little fine villus hairs, we call them, you can still try to stimulate them through using PRP. Because down in the root of the hair, there's a little place called the bulge where the stem cells live. So if they get those factors like you know, like epithelial growth factor, or you have fibroblast growth factor and all those things, it will tell them to wake up again, and you know, the cost is a lot more reasonable.
Okay. And how long does it take to do the PRP procedure?
Yes, so while we talk, I guess I'll draw your blood so we can, you know, get things going. You know, so when we draw your blood, we'll take it and spin it down. That takes about, you know, 15-20 minutes, because I like to spin the blood twice to really concentrate the plasma. And then from there, we want to use it within 30 minutes when it's active. So, you know, you really want to be, you know, get some really good active PRP. And that will work the best. So, first step is, of course, drawing the blood here.
So, apart from drawing my blood here, is there any other painful?
Well, it could be a bit painful, but what you want to do, we like to make things comfortable for the clients as much as possible. So you could, you know, get numb. You know, we can do topical numbing. You could do, you know, injection numbing. And the best way to do it would probably to be a nerve block, where you block the nerves that go to the scalp. So it'll be pretty painless and comfortable for you.
And how about, is there any downtime for PRP?
Well, I mean, I hope we don't draw your blood like we're vampires here. We don't take that much blood. I'll probably take on you about 24 cc's. But every time you concentrate it, out of that, we should get a good 6 cc's of very hyperconcentrated active PRP. And that PRP is great because we can use it for other things as well, not just for hair growth. Like I said, it stimulates growth. So, I mean, if you have a damaged joint, for example, it can help to regenerate the cartilage, you know, delay surgery by a few years. Also, it's used in sexual health as well. It's great for, you know, because the cells anyway, they everywhere get a little bit, you know, stunned, even in the sexual organs. So you try to wake them up. So that's another popular way we like to do that, using PRP.
And is there any side effects?
I'd say, you know, well, it's your own blood, so you shouldn't be allergic to it, right?
Okay.
And, yeah, I wouldn't say necessarily. Most people do pretty well with it.
Okay.
And here's for the next step.
Well, that was pretty good.
Didn't hurt you too much there?
No.
Okay, that's great. So the next step is where we go ahead and spin down the blood. And using a centrifuge, this will spin the blood down and separate it into the different layers. So you'd have red blood cells, white blood cells, the buffy coat, and the plasma. And we'll show you that when we get it out of the machine. So when the blood is spun down, it separates into layers. The red blood cells, the white blood cells are here. The platelet-rich plasma is here, and then we have platelet-poor plasma up here. So we'll spin again to get the real concentration of the PRP, so we can use it for the procedure. So here's the PRP nicely mixed up. We got about 6 cc's. So now we'll go ahead and proceed with the platelet-rich plasma to the scalp. How you doing, Dr. Nichols?
I'm doing good.
All right.
Looking forward to doing this.
All right. So generally, you'll assess the patient's, scalp. We see here there's some thinning of the hair. There's a Norwood classification for gentlemen that we use. But what we'll go, you can see that throughout he still has hair. It's just a little bit thin. So we'll go throughout all the areas here. You can still see there's quite a bit of vellus hair that we can, we put the PRP applied throughout all this area here. And you can see where his hair is nice and thick in the back. And we want to see, but this is not an instant thing. It will take some time to get the full result. And you may need a repeat, application. All right. So after we clean the client's scalp really well with antiseptic wipes, and go ahead and perform a nerve block to hit a couple of the nerves that run to the scalp, to occipital nerves. There's a greater and a lesser occipital nerve, so that the procedure will be comfortable for you. All right. How you feeling, Dr. Nichols?
Everything is good. That was good.
All right. So we want to use this liquid gold while it's nice and fresh within 30 minutes. So I'm going to go ahead and inject in all the areas that we see thinning. All right, Dr. Nichols, we're going to start here. Tell me how you're doing. Is that something you can tolerate?
Yeah.
Okay. So pretty much that's the procedure. We'll go throughout his entire scalp, and we'll go ahead and inject the PRP. We just go in pretty shallow. We just go close to the roots of the hair follicles. As we mentioned, we want those bulge cells to get activated by the plasma. Are we doing okay? All right.
It's more sensitive on the sides.
Oh, the side. Yeah, we go ahead and add a little more numbing there. All right. So thanks for joining us today. I hope you learned something. Please look below in the description box for our contact, social media, etc. We'll be happy to see you here in the office to help you with your hair growth needs. See you next time.